Embedded in this presentation, there are some cartoons. They're there to help the student gain a better understanding of any kind of mental health problem that we're discussing. They're not there to belittle someone or make fun of anything associated with mental health. So I apologize up front if anyone takes offense to these. First, let's recognize some mental health problems. Boredom in itself, everyone feels bored sometimes in their life, but you can't feel bored all the time. If you do, it's going to lead to some problems. Constant illnesses, if your mind is in a negative situation where you're feeling depressed, it'll weaken your immune system, and this can cause your body to constantly get sick all the time. Someone who has chronic anxiety or guilt, or constantly feeling anxious about things, or feeling guilty about things, this is a problem. Everyone feels a little anxiety, a little guilt, can't be all the time. Failure at work or school, especially when someone hasn't had anything like this happen. Everything's going fine and all of a sudden they start failing at whatever they're doing. Not letting others get to know them. Some people put a shell around themselves, and even the best friends they have, they won't let them know who they really are. And then unexpected failures in personal relationships, where you never ever imagined that they'd ever have problems, and everything has completely fell apart now. Where to get help? For mental health problems, here's some areas you can go to. First of all, if you look at the first link up there, it'll let you know any mental health centers in your area. You can go via state and break it down from there. You can go to the hospitals. Most hospitals have a psych ward in which you can go to, where it has a trained nurse there on staff. There's a doctor on call that could come in to help you. Crisis interventions, there's several hotlines out there for different mental health problems. You can call them. They'll provide you with counseling and assistance. The health department, if it's still open, you can go there and receive some help. If there's an emergency, you can call the police or fire department. You can contact the local clergy. Many clergy members are actually trained in some form of counseling for mental health. There's rehabilitation centers if you're dealing with something like drugs or alcohol. And there's all sorts of health organizations depending on whatever your issue is. What kind of mental health specialists are there out there? Well, there's a psychiatrist, and of course the psychiatrist has also got a medical degree and they can prescribe medicine. A psychologist, on the other end, all their training is in psychiatry and they can't prescribe medicine. There's a nurse psychotherapist. That's one of those to be working on that ward, the psych ward at the hospital. Clinical social worker. They're trained, of course, to come out, these social workers are, and help with all sorts of family situations. Licensed professional counselor. There are people that can help provide you counseling. You don't have to pay the price for a psychologist or psychiatrist and go there for help. Mental health counselors, they exist too. Certified alcohol and drug abuse counselors. Again, we're dealing with several different counselors here. Marital and family therapists, and many people will go for marital counseling. Hopefully all go to marital counseling prior to getting a divorce. And then there's pastoral counseling. Therapeutic approaches. Here are some of the therapeutic approaches that we're going to look at. If you can tell me who this guy is over on the right-hand side here and bring it in when you come in, I'll give you a 5-point bonus. Make sure you put your name on your paper. Repression. Repression is a therapy that removes the anxiety-producing thought or event from your conscience. The therapist is going to work on getting you to forget it, put it away. Don't ever think about it. They know it's a problem, and they just don't want you to bring it to the surface if you're not ready to deal with it. Psychoanalysis. This is where the patient's going to examine their past experiences so they can understand them, and then so they can affect their present thoughts, emotions, and actions. This is where you lay on the couch, they talk to you about things, and maybe they find out that your entire problem is the feelings you have to your childhood, something about that, or anything like this nature. Client-centered therapy. This is where the client actually knows what they're doing wrong, and the therapist actually helps them establish a treatment for them. It's all goal related and steps related, and they help the client do this, but the client knows that there's something wrong, and they're involved in developing their treatment. Behavior therapy. Now, this is where people get training, and the training could be like include stress management, biofeedback, relaxing training, any type of thinking patterns or behaviors. We're trying to change the behavior, so we're going to give you training on how to deal with a situation differently. Cognitive therapy. Now we're looking for patterns in your behavior that leads to your troublesome feelings or something, or way you handle things. Let's say you have problems with anger, and it's completely a different issue, anger in a form of violence. Well, we find out that part of your pattern is when you don't talk to someone and use their name, this causes you to think of them as an object, and therefore you lash out. So then we give you some type of, we talk to you and get you to think more cognitively and think of everyone as a person, and then this won't happen. Behavior modification therapy. This is where the therapist is going to teach you new behavior patterns. And they use positive reinforcement, like the dog getting a treat here, or getting some stickers when you're a little kid, or negative reinforcement. Here we have a prisoner doing the dying cockroach, and of course the kid in timeout. So this behavior modification is used all the time in our society too, just by anyone. Group therapy. The group is going to meet with a therapist or some type of certified counselor, and they're going to kind of act as an executive officer of the meeting. Everyone's going to get a chance to share. They're going to make sure other people don't step on one another, and they all come together and find new ways of behaving in which either the group itself can get along better, or the individual can respond better to their situation at home. Alcoholics Anonymous is group therapy. Family therapy. Now, this is where the family is the group. Usually there's some kind of problem where one family member dominates the rest of them, doesn't let them speak, or several of them they just don't listen to one another or understand one another's feelings. So they need to have a way to learn to communicate within themselves. Psychopharmacology. This is where not only are we using counseling, but we're also using medicine. A lot of times this is done for depression and other things of this nature. Movement, art, and music therapy. This is where the person is having trouble expressing themselves, and we use music, art, and movement to help them. I've seen this used a lot of times with children in which their parents were lost in combat when they were way too young, and they close themselves up and are not able to deal with daddy's not coming home, and they'll bring counselors in a lot of times, and they'll start with this. This works wonderful. I've seen it. Electroconvulsive therapy is what we used to call, or still do, electroshock treatment. This is used in pretty extreme cases. Usually something's extremely wrong. So the depression is so bad, your delusions or hallucinations are so bad that they're threatening your life. I mean, their sleep patterns, everything. It's got to be something so bad that you cannot have a normal life. And we can't treat it with drugs or psychotherapy. It's just not working.